Hello? Hang on. That working better? Yeah, that's Carl, all right. Yeah, no, I'm in and out. If you guys can hear me, let's go from here. Does that sound okay? Yeah, super cool. Great. Thanks, guys. Okay, so what we're going to talk about today is a huge problem. Now, this whole problem kind of started during the pandemic, and CallMyDoc has been massively improved by the pandemic to automatically be able to answer patient calls and transcribe them directly into tasks, which are then routed directly to the person that needs to deal with them. So we're going to walk through a couple of aspects to this. The first part we're going to have a look at is after hours piece, and then we're going to discuss the daytime piece, only because the after hours piece uses the app and the daytime piece is primarily focused on just answering calls that can't get answered by a live person. So we're part of the Allscripts program. One of the things I want to say about Allscripts is that they do have one of the best, if not the best, integration programs in the industry, because their ability to allow just about any type of integration with their platform, which we really appreciate. Okay, so what's happening today and in general is no matter what people want to think, at the end of the day, 80% of all communications to any practice in the country have something to do with the phone. It's just how it is. People want to be able to go to a McDonald's drive-thru and pick a number 3, and then they're done. I don't know if it's worse now after the pandemic and with everything that's been happening lately or not, but what I do know is that 80% of all communications with your practice are going to go through the phone. So there's no way out of that. Now, what we've done is we've tried to take as much work off of that as we can off of your practice and the staff, whether you're using it after hours or during the day, because it's not going away anytime soon. Another thing that we hear about all over the country is the difficulty in people being able to find staff to help with their practice, and then there's the training and this and that, et cetera. So that's another problem that we help alleviate. This is an analysis of 9 million patient calls. So CallMyDoc was originally started in 2013, and to date we've delivered successfully with no problems 9 million patient calls. So what we did is we've been doing an analysis of what do those calls look like. Now, where our system works is that when people call in, we can automatically map their question into one of 12 different categories. Because at the end of the day, when somebody's calling your practice, they're not calling for a pizza. They're calling for the same things over and over again. I need a refill, I need this, I need that, et cetera. So what we did is we did an analysis of those 9 million calls, and essentially, in order to listen to those calls, whether you're doing it live or you're listening to a voicemail, the average question time is 22 seconds. What we do is we take that question, figure out who the patient is. We transcribe it automatically into a task. And then it goes directly in the inbox of the person that's supposed to work on it. So at the end of the day, instead of it taking 22 seconds, it takes about 4 seconds, because your eye can actually process information much faster than the ear. Your ear can only go so fast, and that's a huge difference. Plus, you don't have to figure out who the patient is and this and that. You're just reading and processing and dealing with tasks the way you do now anyways. Just all automated. So the way our system works is that you can use it to prioritize which calls get answered first and which ones you could call them back. Because not every call has the same level of priority. A couple of examples. One example is you need as many appointments booked as possible, or you can't make any money. Now, somebody that calls with some other type of question, let's say it's a billing question or insurance question, and who knows what, it ties up the front desk for 20 minutes or ties somebody up for 20 minutes, it's possible that you may be missing being able to book other patients. So the idea in terms of prioritizing which calls, some of those calls, you just simply let them all go to CallMyDoc to call them back. I'm going to show you guys I'm going to show you guys different examples of this. That's kind of the essence of prioritizing. You're just reading tasks and dealing with them. And CallMyDoc is like hiring additional people to answer the phones, but at the end of the day, it tracks also everything that's going on. So there's tons of information and statistics about how many calls you got, what kind of calls you got, when the call was transcribed by CallMyDoc, and when it was closed out in Allscripts. You're always going to know what's going on all the time if CallMyDoc is answering the phone. The net result is that this is just one example that I took, okay? So in this example, out of more than 20,000 phone calls in a month, if you take all the bars between 1 hour and 6 hours, you add them all up, they're going to be greater than the one that says more than 6 hours. So at the end of the day, if you're using CallMyDoc to help manage phone calls during the day, in general, the staff and everybody's able to take care of the calls, and through a combination of prioritizing transcriptions and figuring out who the patient is, you can handle most calls in less than 6 hours. CallMyDoc self-documents all the calls. It helps providers to be able to screen who's calling. And the app itself, which I'm going to show you in a minute, is capable of automatically calling the patient back for a variety of things. They can leave notes from the app for the staff. So the net result for that is that when the provider is on call using the app, it's much less work to be able to deal with calls when you're not in the office. So at this point, the easiest way to explain what we do is just to show you. Now, I know that people might have a variety of different calls, but if you could just, questions, if you could just hang on for a minute, we'll get to a variety of different questions. So what I'm going to do here, I'm going to call this phone number. Now, the way the system works is that we set up dedicated phone numbers for your practice. You can have as many phone numbers as you want. Every phone number is connected to your charts, and every phone number can automatically transcribe into different patient case types. But what I'm going to do is I'm going to call that phone number and show you how the system works, first after hours and then during the day. And I wanted to mention what I just said, because when you see what happens and you hear what happens, 99% of this can be customized for your practice. In other words, we have practices all the way from the U.S. Virgin Islands to Alaska and Hawaii. And the way people manage their phones can be very different from practice to practice, even if it's the same specialty or primary care, et cetera. And so our system can accommodate a zillion different ways it can be configured for after hours, and a zillion different ways it can be configured for being used during the day. So this is just set up a certain way to illustrate various things that we can do. Okay. So let me call in here. And I think as we go through this, tons of questions will get answered, but you'll probably have tons more questions. So let me just do this first.
Press 1 for English. Presione 2 para español. Appuyez sur 3 pour le français.
Okay, the reason why we have these different languages is because what we do is we automatically transcribe from Spanish or Vietnamese directly into English before we create the task. So that's why that's there.
Press 1 for English. Presione 2 para español. Appuyez sur 3 pour... Please select one of the following. Press 1 for Sphinx Medical Technology Sales and Support with CallMyDoc. You have reached Allscripts Pro Test Office. The office is currently closed. If this is a medical emergency, please call 911 or go to the nearest emergency room. If you are an established patient or calling on behalf of an established patient, please press 2 immediately to be helped as Please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the year of the patient's date of birth. You have entered September 18th, 1963. If this is the correct date of birth, press 1. If not, please wait while we look up the medical chart for the patient. Using your keypad, please type in the first 3 letters of the patient's last name. Please wait while we look up the medical chart for the patient. If you have a question about your bill or labs, or some other non-urgent issue you would like to share with our office, press 1. Press 2 only if you have an emergency and need to speak with the provider on call. Would you like us to return your call to 310-402-5573? If yes, press 1. Please speak the patient's full name slowly and clearly. When done, press any key. Then you will be asked for more information.
Carl Silva.
Now, please leave a detailed message as to why you are calling, any symptoms you are experiencing, and any other information that would help us expedite this call. Please speak slowly and clearly. When done, press any key.
Okay, so at this point, it's listening to me. And it's going to transcribe everything I'm saying into a task. And we'll look at that. It's also going to push this transcription to the app with my chart. We'll look at that as well. Everything you heard up until this point, except for the part where it asks the patient for their date of birth, can be customized to say or do whatever you want.
Once the provider or office has listened to your message, we will contact you at 310-402-5573.
There it is. Okay, so using it after hours, you forward your calls to your CallMyDoc after hours number or numbers, depending on how you want it set up. The on-call schedule is in the system, but knows who to direct the call to, who's on call. And when patients call in, they enter the date of birth because that's what they have to do no matter what. In other words, if a patient calls your practice during the day and whoever answers the phone doesn't recognize their voice, they're going to have to ask them for their date of birth. It can't work any other way. We just do the same thing. So at the end of the day, as long as the patient has a phone and remembers when they were born, that's that. There's nothing special about it. The system we're discussing right now currently handles 350,000 patient calls a month in 34 states, and it just works. I mean, plus this is 2022. Get a phone, remember when you're born, no problem. I could show you statistics and demographics from just about any part of the country, and people are just using it, doesn't matter what the age is. Now, once we've identified who the patient is in this example, there's two things they can do. Now, first of all, as I pointed out before, when patients are calling in, they're not calling for a cheeseburger. I mean, they're calling for the same stuff over and over again. So we have the ability to automatically transcribe what they're calling about and push it directly to the inbox of the person supposed to work on it. So question for billing comes from a patient, routed, depending on how you want it routed, directly into the inbox of the person that's supposed to deal with that. And you can have a phone number, you can have multiple phone numbers, any combination of anything that you want. We don't charge extra for the number of phone numbers. We just set the system up so it'll do exactly what you want it to do in terms of helping answer the phones. Now, when it comes to after hours, that's done through the app. And the app, I just happen to have an iPhone here, but this could also be an Android. It doesn't matter. The app is going to work and behave identically on Android and on the iPhone as well. Now, how I get notified, when I get notified, and for what types of calls I get notified is completely customizable. So I'll click on that notification, logs me in, and there's my call. When I click on it, completely different experience than what's happening today after hours. In other words, we don't just throw a live call into somebody's lap at 3 o'clock on a Sunday afternoon because you don't know what's going to happen to you. It's very stressful. This is completely different. Who's calling? Why are they calling me? Right here. And then you could swipe the screen like this, or you could press this button. I don't know why there's hardly any data on this chart, but you'd have the diagnostic codes from the 3 most recent visits. You'd have active allergies, active medications, and lab results here. And then you either swipe again to hit take session, or you hit this button, and you hit take session. And the reason why you have to do that is because CallMyDoc documents every phone call and phone encounter and puts it back on the patient's chart by itself. So everything's written down for you after hours. Now, if I want to call this patient, I hit this phone icon, and I hit this green bar at the top, which is the number they called. If I wanted to, or if I had to, I could hit one of these other numbers that's coming from their chart. I'll just hit this one. This is going to set up a real-time conference call out of a server between me and the patient. So it calls me first.
Patient, connecting you with the caller.
And now my patient phone is ringing. and this would ring with the caller ID of your practice.
Hello, this is Allscripts Protest Office calling you back.
Boom, connected. Great. Okay, so that's one thing. Now, the other thing the app can do, you can do any combination of what I'm doing here, but you can also use the app to call the patient back or do a variety of other things, and you don't necessarily have to call the patient back. So if I click on prescribe here, if there were meds on this patient's chart, they'd show up immediately, but let me just put one in. It's search. Now you have to tweak these fields a little bit because we have to tune this up, but this will send the prescription to the pharmacy. Then it will update the chart. Then we'll call the patient back and tell them where to pick this up. And I don't have to call anybody. I'm also going to have it call the patient and tell them something. I sent in your refill, but we haven't seen you in a really long time. So when you get a chance, could you please schedule a time to do a medication review? And this little box down here doesn't go back to the patient. This is for people to take notes about the call. For future reference, this will go back onto the documentation, et cetera, but it doesn't go back to the patient. I sent in this patient's refill, but we haven't seen them in over 6 months. So when you get a chance on Monday when you come in, could you please schedule them to do a medication review? And then you always hit close session after you hit take session, and now it's going to call the patient back and do everything I told it to do. Hello?
Hello, this is Allscripts Protest Office returning your call. A patient at this phone number contacted us with a medical issue. We are calling back now with the provider's answer. If you are the patient or a HIPAA authorized individual, press 1. Allscripts Protest Office has the following information for you. You can repeat this information at any time by pressing 1. Please listen to the entire message. This message has 2 parts. Part 1. The provider has prescribed the following medicine. Advil 200 mg oral capsule. As needed, the prescription has been sent to the pharmacy. Allscripts Local Test Pharmacy. Located at 85296 Forks Road. Please call the pharmacy to confirm it is ready at 919-851-6700. Part 2. I sent in a refill, but we haven't seen you in a really long time, so when you get a chance, could you please schedule a time to do a medication review? Press 1 to repeat this information. Press 2 to confirm you have heard this message. Do you wish to start a new session with the provider for another issue? Press 1 for yes. Press 2 for no. Thank you for calling Allscripts Protest Office. Goodbye.
So you get CallMyDoc numbers. Each one's programmed to handle things in different ways according to whatever you'd like it to do. Patients call in, they enter the date of birth, so that way if the provider on call gets the app, they know what's going on, they get a heads up about what's happening, and there's no confusion or problems, and they can screen their calls. Now, this is what we call the admin panel. Now, at the same time, there's messages on the admin panel creating tasks. And what's going to happen is when we're finished, everything about this call is going to go back in the chart. I'm going to show you the daytime ID in a minute. But at the end of the day, if I delete these tasks from my inbox, or I archive it from here, either one of those means, okay, we're completely finished with this call. I took care of it. And now it's going to document the call and put it back on the patient's chart under phone consultation. the summary at the top and the detail at the bottom. And what we're doing here is that we create hot links in the PDF file back to the original recordings. So you always know what happened 2 years or 3 years or whenever. We document that stuff and keep it forever. What you're going to wind up with is basically a dashboard of everything that's going on that you can't answer live. You never want to use voicemail ever again. It's a complete waste of your time. And as I mentioned before, you can have as many phone numbers as you want. When you look at this picture, pretty easy to figure out what needs to be done here. So somebody's got to take care of that because that's probably lab result questions. Somebody's got to book these people, take care of these refills, and then you deal with this and you deal with these later or whenever you get to it. We're also going to capture calls that might not have a specific date of birth, like other could be a new patient requesting to be part of your practice, et cetera, et cetera. And as I mentioned, at the end of the day, we track everything that's going on 24 hours a day, 7 days a week. So at this site, we're currently handling about 4,000 plus calls a month. And if you added up these bars, you're taking care of most of the calls in less than 8 hours, it looks like here. Now, the way it works during the day is really simple. Okay, so everything in blue is CallMyDoc. Everything in green is your existing phone system. So your phone system might say, okay, press 1 if you're calling from a physician's office, press 2 if you need an appointment, 3 for medical questions, etc. Right? You can have as many phone numbers as you want, and every phone number can be programmed to handle things however you want them handled. So in other words, that phone number is associated with this CallMyDoc dashboard. It creates tasks for these people or whatever inbox or inboxes you want it to go to. It's the type of task it creates, and when it documents it back to the chart, it's going to create this. Now, the way it works is extremely simple. These are just regular phone numbers. You can call them directly and test them and see how it's going. This part is the key, because basically what we're doing is we're taking advantage of a feature that's in every phone system on the planet, which is called selective call forwarding. So that's a very fancy term for what should the phone system do if it can't answer the phone, if you can't answer the phone. So after 6 rings, or if it's busy, whatever, what should happen? Now, typically this stuff just goes to voicemail, because what else are you going to do with it if no one can pick the phone up? Since these are all connected to the charts and they know how to create tasks, at the end of the day, this is like hiring 1, 2, 3, 4, 5, 6 new people to answer the phones. So the phone system thinks this is a bunch of people or call centers. Doesn't even care. All that matters is that after 6 rings, they should go over here. And in some cases, they go over here directly. In other words, if you look at this picture, there's 2 things going on here, major things. First of all, for what this practice considers the most important types of live calls that should be picked up by a person, physician's office appointments and medical questions, it goes to a person first. In other words, the phone system forwards a call over, sends a call to a person first. If that person cannot pick up, or persons, after 6 rings, or if there's busy signals, and it goes to the CallMyDoc phone number. Now, these numbers are non-blocking. In other words, if 10,000 people call or forwarded to one of these numbers, all 10,000 calls get answered. The other thing they're doing here is they're prioritizing what stuff can wait for a callback because it can wait. It doesn't have the same level of priority of these things. So when you call this practice for a refill or calling from a pharmacy or medical records or billing questions, 100% of those calls are transcribed. And directly from the caller into the inboxes of the people that are supposed to deal with this. So during the day, you're going to have at least one CallMyDoc number, if not several numbers. It's not tied to pricing, so don't worry about it. That answer phone calls if a live person can't pick up, and they're sent over depending on how you have set up your phone system, whether you want it to bring a person first or just go right to CallMyDoc. And if you're using it after hours, you would forward your calls directly to your CallMyDoc number. In this case, I have two numbers, and on-call scheduled in the system. So in this example, from 5 to 10, it goes to an on-call service. And from 10 to 8 o'clock in the morning, Dr. Kanopsek is on call. So let me just go over here again. So at the end of the day, 80% of all interactions with your practice go through the phone, and that's not going to change. What you do with CallMyDoc is you prioritize which calls get answered first, and if they can't, it goes to a CallMyDoc phone number, or it goes direct to a CallMyDoc phone number. And we've measured the productivity improvements scientifically. So based on 9 million patient calls, we know the impact it's going to have on your practice. And it has side benefits as well that we didn't even talk about. For instance, some of the side benefits are somebody says they called your practice 20 times on a Tuesday, and it's not in a task. They didn't call on Tuesday. It's impossible, or they just hung up every time. Another side benefit is that if a stat lab result comes in at 4:55 on a Friday evening, it's not going to be in a voicemail till Monday morning. It's going to be there on your CallMyDoc dashboard, and it's going to be in a task. There's many other side benefits to this that we didn't even talk about. So we don't charge any setup fees or one-time charges of any kind. Period. You get a minimum of 30 days to try it out for free. If you need more time, no problem. If you want to use it after hours, then the pricing is based on the on-call schedule. So it's $129 for the first provider on call, $49 for additional provider on call. If you use it during the day, it would be $129 for the first provider at that location, $49 for additional provider at that location, and it includes the after hours component at no additional charge. There's no long-term contract, no cancellation fee. You can cancel whenever you want. And as I mentioned before, you can have as many phone numbers as you want. We'll be sending this out after this webinar, but if you want to try it out at no charge, we just need some information about your Allscripts client account number and a contact person. And then once Allscripts has it configured and they give us the green light, we can actually set up the system, at least the initial part of your system, within 20 minutes to half an hour, because we do this all the time. So that's kind of it. Let me see if I can figure out how to turn this over for questions. Can you hear me okay? Boy. Yes, you can customize everything about the system when the patient calls in. When it says after hours show the entire patient's chart, no, it doesn't show the entire patient chart. It actually just shows the last office visit. We've looked at adding notes to that as well, but right now it's just those different pieces. In terms of the correct patient, the way the system works is that when the patient calls in and they put in their date of birth, if there's more than one chart with the same date of birth, we'll prompt for the first three letters of their last name. If there still isn't a resolution of which chart it is, we're going to prompt for the first three letters of their first name. Then the last piece is that if there still is more than one chart, we'll either ask them for the last four of their social, the last four of their driver's license, or the last four of their insurance card. So one way or another, it's always going to work. Yes, the pricing is no setup fee, no customization fee, no one-time charges of any kind. As a matter of fact, if you started using it after hours, and then you decided you wanted to add the daytime piece, or vice versa, there's not going to be any setup charges or fees for setting any of that up, or any customization fees. You get a minimum of 30 days to try it out for free. And if you decide to keep it at the end of the 30 days, it's $129 for the first provider, $49 for additional provider, month to month, no long-term contract, cancel whenever you want. Does anybody else have any other questions? In terms of cancellation notice, don't worry about it. You just say, I don't want it anymore, I cancel, or it's totally up to you. You can either cancel it instantly, or we can cancel it at the end of the month, depending on how you want to do things. But the interesting thing about it is that because it doesn't cost anything, you just don't have to get rid of your other answering service until such time as you're sure CallMyDoc's going to work 100%. But it's 9 out of 10 practices keep it once they start using it, because it makes such a huge difference during the day and after hours. We're not worried about it. We're pretty sure that you're going to want to keep it. Are there any other questions? If not, then thank you for attending this, and I appreciate your time. Oh, hang on. Yes, the task goes to the inbox in all scripts. But what's going to happen is we could also send an email to somebody if they should go to remind them to go check their inbox. So the best way to look at Call My Doc in terms of trying to understand how it works, don't worry about it. In other words, we have so many different ways we can configure it. We're in so many different practices across the country. The easiest way is to just say, look, we want these 5 phone numbers that do this. We want an answering service phone number that does that. Set it up, and we'll just make it do that, whatever you want. Any other questions? Oh, why there's a bit of a delay in here. I apologize for that. Okay, well, thank you for attending. And as I mentioned before, we will send this information and this recording to all the attendees. And I very much appreciate you taking the time out of your day to have a look at this. I'm sure if you give us a shot and try it out, we can help you with managing the phone calls and make everybody's life much easier, yours and the patient's, okay? Thank you.